Health benefits of carrots. Much of the research on carrots has focused on carotenoids. Reduced risk of cancer. Diets rich in carotenes may have a protective effect against several types of cancer. This includes prostate cancer, colon cancer, and stomach cancer. Women with high circulating levels of carotenoids may also be at reduced risk of breast cancer. Lower blood cholesterol. High blood cholesterol is a well-known risk factor for heart disease. Intake of carrots has been linked to lower cholesterol levels. Weight loss. Carrots, as parts of meals, can increase satiety and decrease calorie intake in subsequent meals. For this reason, carrots may be a useful addition to an effective weight loss diet. Eye health. Individuals that are low in vitamin A are more likely to experience night blindness, a condition that may improve by eating carrots or other foods rich in vitamin A or carotenoids. Carotenoids may also cut the risk of age-related macular degeneration. Carrot consumption has been linked with reduced risk of cancer and heart disease, and improved eye health. They may be a valuable component of an effective weight loss diet. Organic versus conventionally grown carrots. Organic farming uses natural methods for growing the crop. Several studies have compared the nutrient content in organic and non-organic carrots. These studies did not find any difference in the amount of carotenoids or antioxidant content and quality. There is no evidence that organic carrots are healthier or more nutritious than conventionally grown carrots. Thank you for watching.